Well, good evening, everybody. You're very welcome to the joint webinar on the theme of returning to school. This is the last in a series of joint events organised by Cystic Fibrosis Ireland, the Asthma Society and the Irish Lung Fibrosis Association. My name is Philip Watts. I'm CEO of Cystic Fibrosis Ireland, and we're delighted to be working together with the Asthma Society and the Lung Fibrosis Association. And we understand this is a very anxious time for parents and guardians of children and young people seeking to return to school at the end of August and the beginning of September. We know the anxiety is twofold. One is that parents are anxious that their child is safe going back to school, but they're also anxious that their child doesn't not miss out on education, and particularly if this is an important year like the junior cert or the leaving cert. We have an excellent panel of contributors this evening, including Professor Martin Cormigan, who's a HSC lead on antimicrobial resistance and infection control, and Ruth Morrow, who's a respiratory nurse and specialist from the Asthma Society. The webinar this evening will be about an hour long at most. We know you're very busy, and we know that it's a fine evening, so we aim between 45 minutes and an hour. And because so many people have joined us this evening, there's well over 150, we don't have the technology to have a discussion, unfortunately, but we've invited your questions and concerns in advance. And Liz will be summarising these shortly. We very much see tonight as a two-way process, and we'd welcome further feedback on the issues and concerns you have about students returning to school. And we see this process as a start and not an end. And the issues that you raise this evening, we will feed back to the Department of Education. We are very strongly conscious that school is so important here in CFI, and we really want to support the momentum of getting everybody back to school as much as possible. It's so important from a society perspective. And we'll have further discussion about this evening, but just to say a couple of things about tonight's webinar. We don't know everything, and even the expert panelists who will be discussing the issues of going back to school, they won't know everything, and things are bound to change over the next few months. Indeed, my own sister is a school teacher in Wales, and they went back 3 weeks ago, and she said a lot of stuff changed even when they got back into the classroom. So the first things that sometimes goes out the window is the original plan, but I think we're very confident about the quality of our schools and teachers to deal with this crisis as they've done to now. So please don't expect that we know everything. And the other thing is, as with modern technology, something is bound to go wrong this evening. So I hope you forgive us if there's some glitches in what we're doing. But we have some fun things for you as well, including a little poll that we're going to try as well. So without further ado, I'd like to ask our first panelists to join us now, and that's Liz Jacks, who's our regional officer in Cystic Fibrosis Ireland, and she's based in Limerick. And you probably hear from her accent, she's not from these parts. She worked as a nurse in Australia, and formerly she worked as a researcher with the NHS in the UK, so she has tons of experience. We had hoped that our other colleague, Dr. Sarah Tecklenburg, would join us as well, but you'll hear from her throat. I think she was shouting too much at a GA match. No, I'm only joking, but her throat is actually gone. So Liz is going to cover quite a lot of the stuff that Sarah was going to cover, but she might be able to come in. So without further ado, I'll hand you over to Liz now, who will give you a sense of the issues that you have raised, you've sent in to us, and also some of the things that the Department of Education have planned. So over to you, Liz.
Thanks, Philip. Thanks very much for that nice introduction. As Philip said, we did have a lot of questions that have come in, both around the webinar from the registration form, where we asked you to submit any questions that you had, which were really informative. And also just generally, we've had a lot of queries from our members at Cystic Fibrosis Ireland, and I'm sure from Asthma Society as well, around the return to school. So as Philip said, we're actually going to start today to see if we can gain a bit of a better understanding as a group of your current thoughts and feelings on the return to school. So I've got a little poll that I'm going to set up here, if you just let me have a few minutes. So there should be a pop-up launching onto your screen now, which asks the question of whether you intend to send your child to school in September. So if you wouldn't mind just putting your answer in, you do need to hit submit or click submit after you've selected your answer. I'll give a couple more seconds there for people to have a think about what their answers might be, and we can collect the responses there afterwards. So I see we've got quite a few responses in already. I'll leave it for a couple more seconds. Okay, and I'll end it there. So to summarize the results there, we can see, do you intend to send your child to school in September? The majority of you have said yes, 59%, but a big proportion of you have actually said that you're unsure. 36% are still unsure about what your decision will be about sending a child to school. So I've got a second question that I'm just going to bring up. So the question is, how concerned are you about the impending return to school? So again, if you can think about your answers, how concerned are you? Very concerned, somewhat concerned, not very concerned, not concerned at all. If you could submit your answer and then also click submit at the bottom, just so that we can register your answers, and I'll give it another few seconds there for this one to come through. Maybe another couple of seconds. I can see we're still getting a few responses in. Okay, I'll end that there and share the results with you on the screen. Okay, so we can see the majority of you are very concerned. And in fact, the majority, 99% actually combined, is very concerned or somewhat concerned. And I think kind of the answers to those first two questions really do paint quite an accurate picture of the feedback we receive at Cystic Fibrosis Ireland, that there is a lot of uncertainty being voiced by the community, and quite a significant proportion of families are not sure about what their decision will be about returning their child to school at the end of the month. And actually, I would like to try and drill down just the response to the question here a little bit further, in terms of why you're concerned, or what's concerning you about the return to school. So if you the bottom of everyone's screen, there should actually be a chat button, a chat function. This may look different if you're on a laptop, or if you're on a smartphone, you might need to click through your bubble menu to find the chat function. But if you wouldn't mind using your chat function to just type in 1 or 2 words, just to perhaps explain to us what it is that's actually concerning you. So what's your main concern about your child returning to school at the end of the month? And we saw that 99% of you do have some concerns. So if you could just share with us there, if that chat function is working, if you can just give us an idea, 1 or 2 words, maybe a short sentence, just to indicate what you're most concerned about in terms of returning to school. So I can see some of the responses coming through here. There's quite a lot coming through about contracting COVID-19, transmission in the classroom. A concern there is around lack of hygiene in schools. Things are coming through thick and fast there, so that's really great. That's really useful for us to see what the concerns are. And you can see just through some of those responses that a lot of the concerns are, a lot of the concerns are repeated here. A lot of the concerns are the same sort of theme. Concern that he'll be safe, concern about catching, picking up infection control. That seems to be the predominant concern there. Great, that's fantastic. I'm just going to bring up another poll here, which is on, oh, there we go, excuse me. So I've just put up another poll question, and I hope that that's popped up onto your screen. It seems like it has, because I'm getting some results in already. The question is whether or not you've had contact with your child's school. So it's a yes or no question. I'll give a couple more seconds for this one because it's a fairly straightforward question, yes or no. If you've had contact with your child's school, I'll give it about 5 more seconds here. Okay. So we can see a mixed response there. 61% yes, have had contact with your child's school. 39% no, have not contacted your child's school, have not had contact with your child's school, I should say. So there's kind of a, 2 fairly big groups there. And I suppose speaking on behalf of Cystic Fibrosis Ireland, and I know that this is a view shared by Asthma Society as well, we would really recommend those that haven't been in touch with your child's school to really start a conversation with them. Even if you haven't made up your mind yet about what your decision is about the return to school, have a conversation with your school. That way you can find out exactly what measures have been put in place to ensure your child's safety if you do choose to send them back to school. And you can also then highlight your concerns or maybe your child's specific needs in terms of their respiratory condition as well. And then I've got one other question to ask. Should pop up there on the screen now. So the 4th question is, how satisfied are you with the guidance from government? So I've got some answers coming in now. I'll just give maybe 10 more seconds for people to consider their answer. How satisfied are you with the guidance from government? Almost done. Okay, I'll end it there. So a mix of responses here. Some 17% somewhat satisfied, 9% satisfied, but you can see there 32% are somewhat dissatisfied or extremely dissatisfied. I'm quite interested to learn a little bit more about why that is, why the majority of you have answered that you are in some way dissatisfied with the guidance from government. There's no wrong answers, but again, if you could use your chat function within Zoom, if you could just type in again 1 or 2 words, if you answered that you were dissatisfied with the guidance from government, if you could type in 1 or 2 words or a short sentence about why that is, or which part you're dissatisfied, or what information you think is missing. We've got a few responses coming in, a lot left to local interpretation, feels like we are the forgotten ones, no clear consideration given to vulnerable children, nothing specific related to children with CF. So there seems to be a theme there around lack of information for vulnerable groups, and a few comments there around social distancing for young children, mixed messages being given, and some sort of points there about masks, but who would be enforcing masks. Okay. Fantastic. Thanks so much for all of that really useful information. And I think that really frames the conversation that we're going to have with our guest speakers in the next segment. And also it does also link in with a lot of the questions that we have prepared and the discussion that I know we will be able to have, and hopefully we'll get some answers there or we'll be able to address some of those concerns that you've already voiced as well. So I'm just going to take a moment now to bring up some slides. Excuse me while I just do some clicking. Okay. Thanks, there we go. So, I now just want to take a few moments just to run through some of the policy around return to school and school attendance in general. So when we're talking about returning to school in context of the COVID-19 pandemic, I think we need to kind of acknowledge what the overall legislation says around school attendance, and that's all centred around the Education Welfare Act of 2000. So within that act, it says that children between the ages of 6 and 16 must receive an education, either attending school or otherwise, and you as parents should keep in regular contact with your school during periods of absence for your child. And TULSA have said that this legislation still does apply for this year throughout the COVID pandemic, but for students who are choosing not to attend for medical reasons during COVID-19, and they're being facilitated by their schools to learn from home, those non-attendance days may not count towards the 20-day absence rule. So this really needs to be discussed with your individual school. Again, I'd really encourage you, for those who haven't started the conversation with your school, to start having conversation, maybe discuss what periods of absence might mean for your child in terms of COVID-19 and their particular risk. There's specific regulations around homeschooling, which I'm not going to cover. We don't really have time to cover here, but there is information online. We can also flag that to you in some follow-up emails if that's useful, if that's something people are considering. We absolutely can, but I'm not going to talk about homeschooling here because that is quite a different kettle of fish. I'll just flip through. So this slide is just to clarify what the guidance actually is and where the information has actually come from. So the return to school is largely informed by the roadmap for the full return to school, and that is a comprehensive document from the Department of Education. The roadmap is informed by the 3 documents that are on the screen below, and the roadmap really outlines how schools will reopen and what the operation of schools will look like, and how education and teaching will be sustained within the context of COVID-19. The roadmap also details the financial package that the government is providing, which is 375 million to support this plan implementation. So I'm going to just quickly highlight some of the key elements of the roadmap, just so that we are kind of all starting at the conversation at the same point. So you can see there's 3 key elements of the roadmap: hand washing, physical distancing and face coverings. The roadmap really does provide comprehensive guidance on hand washing and supplies for hand hygiene. There's really clear instructions of when hand hygiene will be applied with students, what that will look like, how upgrading of hand washing facilities will be provided, what that funding will look like. There's a lot of information there on hand washing, and in fact hand washing is one of the 3 main kind of pillars of this roadmap. One of the other kind of second pillars of the roadmap is the physical distancing. We've heard a lot about physical distancing. We know in the news and in the media lately, there's been, difference between primary school and secondary school around physical distancing. But it's important to understand that each school setting is very different in terms of their location, their physical layout, the available space they have, the student numbers they have attending the school. So each school will have to decide on the appropriate way of implementing these guidelines around physical distancing. They'll have to make that decision themselves based on their physical resources that they have. And we know that within primary school, classes will be considered a bubble. Within each bubble, there will be separate series of smaller pods where those smaller pods will interact with each other and they will work with each other continuously on a day-to-day basis. There's been no social distancing rules set for the first 4 years of education, but at secondary level, it does change, where there is a minimum of 1 metre distance to be applied between all pupils, but ideally 2 metres. So it's 2 metres distancing where possible between desks, between students, but it should be maintained as a minimum of 1 metre. Face coverings are also discussed or included in the roadmap. Information about face coverings has kind of changed in the last 7 days or so, but face coverings have been recommended for staff who cannot maintain 2-metre social distancing, and that includes SNAs who should be wearing face coverings at all times because they do generally do closer interaction with students or more intimate care with certain students. And face coverings are not recommended for primary school age children under the age of 13, I believe it is. And secondary school students, just I believe in the last week, are now advised to wear face coverings where they cannot maintain that 2-metre social distancing. So as we said, every school will look different. Every school's ability to maintain that physical distancing or that separation of students will be different, and that's when face coverings will become an important part of the conversation as well. The third sort of pillar of this roadmap is the cleaning protocols. And I won't go too much into the detail about the cleaning protocols, but they're very substantial. There's been a lot of thought and effort into ensuring schools are prepared and have the real vigilant cleaning protocols that they'll need. Each school will be cleaned at least once a day. There's particular protocols for frequently touched areas, frequently touched equipment or sports equipment that's shared, and also there's been additional funding for staff for cleaning, and they've also got specific cleaning protocols if there's a suspected or confirmed case of COVID-19 within the school. And each school will have a sickness protocol that's part of a national guideline as well. So this is if a child presents to school or during the school day becomes symptomatic, what the school will do, how the school will respond. The child would be isolated either in a specific isolation room or isolation area, and then parents will be called, child will be, make sure they can go home safely, and then there's specific assessments to be done and a further cleaning protocol as well after that. So every school will have a general sickness protocol that they will have to abide to, and that is part of the national guidelines. So just a few points on very high risk staff and students. The guidelines do not really refer in too much detail about the very high risk groups, and that's, I think, as we saw from the polls or from the comments that we had from the audience, has been recognised by a lot of families. So there is information that they recognise within the guidelines that some pupils may be advised not to attend school for health reasons, and in those cases it's up to the individual school, which is responsible for ensuring that the pupils receive their support to maintain their learning from home, and that additional support will be given through teaching staff who will support students who have to learn from home because they are deemed high risk due to COVID-19. And just another point there about staff, because I know we have got some teachers who've joined the call today, that staff who fall into that extremely medically vulnerable group may apply to work from home. That's a conversation that you have with your employer, and there is a specific circular release that was released a couple of weeks ago about this, and that can be shared. If there's any teachers on the call, we can certainly share that information with you. So that brings me to the end of a very quick race through of some of the guidelines and the policy around teaching and returning to school. So I might pass you back over to Philip, and we can begin the Q&A section with our guest speakers.
Thanks, Liz, that's much appreciated. I just might ask Sam or Nuala there, just in terms of some of the comments that came up there. Sam or Nuala, are you able to share some of the chat that came back there? I don't know, we're hearing you there, Sam.
I think we've got a bit of background noise there, but I can see there's some questions, Philip, about Rachel has asked, where do we find out about cleaning protocols, so I can put something in front of our principal. We can share links to the roadmap in an email following the webinar for everybody. In fact, we'll probably compile quite a list of different links and resources that we've referred to during the webinar, so we can add that in and make sure that everybody can access it. It's a public available document online, so we can send that information out to you.
And I also believe the Asthma Society have tips for going back to school as well. So I'm sure we'll share that on our website as well for everybody. That's fantastic. So before we go into Q&A, I just might bring in Martin and Ruth. Martin Cormican is HSE lead on antimicrobial resistance and infection control, and Ruth Morrow, as I said, is a respiratory nurse specialist, and we're delighted, and thanks a million for joining us on an August night to talk about this really, really important issue. So Martin, I just throw it over to you. And in fact, Martin was meant to speak at our annual conference this year, which is down in Galway, the Year of Culture, of course, but we had to cancel that naturally. So we were delighted he could join us this evening. So over to you, Martin.
Yeah, Philip, I'm not sure if you want me to go through a couple of specific points in that.
Yeah, that's fine. Yeah.
Okay. Do you want me to load that at this end then?
Yeah. Do you have that, Nuala? Do you have a?
I can do that. If you want me to load it, I can probably do a screen share here if that's.
Yeah, that's brilliant.
Okay.
Nuala, if you'd allow that,
yeah. While I review my mastery of the technology, share screen, I think. You know if that works. Is that something you can see?
Not yet.
Not yet. Okay, well, I can just talk.
Martin, I can actually share it for you. If that's
okay, that might work better, yeah.
There we go.
That's super, thanks.
Okay, so thanks for that. I'm now, oh, something strange has happened with my screen now. I apologize for, I now can't see anything. Okay, it's back. Thank you. Okay. Something bad happened and I went, can you see this? Can you see the slides now? Yeah, okay. Yeah. Okay, thanks very much. So this is just a couple of very brief points, and just go to the first slide. The next slide maybe is just a recap. Slide 2 is, I can't do this. Yeah. So it's just a little bit about transmission, about how it spreads. So the virus comes out in respiratory droplets from people who have the infection, and we all scatter droplets when we speak or laugh or cough or sneeze. If somebody has the infection, then the virus may be in those droplets. If that droplet lands directly in your eye, nose, or mouth, there's a risk of getting infected. The other thing that happens is the droplets land on the top of a desk or some item that you put your hand on. And then when you subsequently put your hand to your eyes, nose, or mouth, you can transfer the virus to there. The virus doesn't go through skin. So what's important is if it gets in your skin, you put in your eyes, nose, or mouth, that can result in infection. And there's a lot of discussion, and many of you will be aware of this, I'm sure. There's a lot of discussion around whether it's transmitted in aerosols or not, and a huge amount of concern around that. The consensus is that aerosol transmission probably does occur on certain very specific circumstances, but it's not a major part of the risk. The contrast there would be, just for purposes, would be, for example, with measles, where we know aerosol transmission of measles is a huge thing and very common. For this virus, if it occurs, and it probably does, it's infrequent and probably not a major part of the problem, with certain specific exceptions. The next slide then. So just to make a point about the droplet and the aerosol, the difference there is that droplets are usually over a fairly short range, and that's why there's so much talk about distance, whereas aerosols can fill the whole room. So that's the big difference there. When we think about controlling COVID, I suppose, and particularly in the school setting, or indeed any setting, one of the biggest things, obvious as though it may be, is that if nobody in the school is infected, then the virus can't spread, because somebody has to bring it in. And that's why one of the most important things in almost every setting is that if people are symptomatic, that they do not come to school. And so we all have a huge part to play there in looking after each other. Whether we're healthcare workers in the healthcare setting, or teachers or students or whatever, if you have symptoms, then it's really important to stay home. We know that that's not going to be perfect. So the next step is you have to say, if the virus gets in, what can we practically do to reduce the chance of it spreading? And that's my second circle there. And that's about distance and cleaning, use of masks. All of those things are about reducing the chance of it spreading if it gets in. But first you try to keep it out. The third part then is about the harm. And that's really the issue. If this virus did no harm, and there are viruses that do no harm, then the spreading wouldn't matter. The problem is the harm. And preventing the harm as the virus spreads is about a number of things. One is about keeping yourself as well as you can in terms of you're looking after your general health, and obviously getting help early if you develop symptoms. And those are key parts about how we think about the virus. I'll move on to the next slide, perhaps. Thank you. This is just a little bit about the testing. The next slide, please, is just that there are two types of tests that people talk about, and many of you will have heard about these. One is where you're looking for the virus itself, in fact, looking for the virus genes. And that's the test that's usually done on the swab that's taken from the throat. There's a lot of work going on now also about doing that test, particularly in kids on saliva, because that would be easier for children. But we're not there yet, but I think that we will see a move towards testing other types of samples. The test is not positive in everyone with infection, so it's not a perfect test. It's usually positive by the time people have symptoms. One of the things that we've learned over the last few months is that it can stay positive for a long time after you get better. So we've had people who've been better for weeks and this test will still be positive. So now we try not to do the test anymore on people once they're better, because we know it comes back positive often and it just causes confusion. So once people are better, we just say stop testing, it's not going to help. And in the other test, we've moved on there. I'm going too slow, or just go back just a minute, a little bit. There. And then the other testing that people are talking about is the blood test, not widely used at the moment, but you will probably see some more about that as the year goes on. Okay, and we'll go on then. Just a quick mention about immunity. So we'll go on to the next slide. Is what do we know about immunity? Well, if you get infected and you get better, and most people do get better, then there is a degree of natural immunity. Hopefully when we have a vaccine, there'll be vaccine immunity. There's a lot that we don't know. The immunity may be partial, it may help, it may prevent you from getting seriously ill, but it might not stop you getting infected. We don't know for sure how long immunity is going to last, but based on what we've seen with other coronaviruses, it's probably not going to be lifelong, but it might be sufficient to prevent the disease in most people at least. And we just go on to the next slide. Thanks. So the future, so it's very difficult. Nobody knows, and there's a lot of uncertainty. And I think Philip covered that very nicely in the introduction. I think the virus is never going to go away, but I think what's likely to happen is that the harm that it does will reduce over time. That harm will reduce faster and with less harm if we get a good vaccine, and the sooner the better. And the challenge for us in the meantime is how do we manage the risk of harm? And this is very much, I think, a question about going back to school. So how do we manage the risk of harm from infection and manage the risk of harm from unintended measures related to the risk of reducing infection? And that's, of course, I suppose, what lots of us are thinking about. And I have a girl myself who is going back to school in September. So it's that issue of what is how do we manage, how do we live with the risk in the meantime? And it's a really difficult and very personal decision, I think, for all of us. And I just would acknowledge that I don't think there's one right answer for everyone, and certainly not for people who have lung disease. It's a really difficult, and that's really all I wanted to say. There's a lot I don't know. There's things there are things that I thought I knew in March that have turned out to be not quite what we thought they were. I think we're going to continue to learn. And, one of the things I would say is just to be very careful. There's a lot of misinformation out there. We try to give the best information we can on the HSE website. Things do change, but I would be very careful in particular about misinformation and a lot of people marketing products which are of little or no proven value. And I would just be very careful about those. Thanks very much. That's it.
Thanks, Martin. That's very much appreciated. And before we open it to maybe some of the questions that you've raised, I might bring in Ruth. If you just might even say hello. So Ruth Morrow is a nurse who's working with the respiratory nurse specialist, working with the Asthma Society. And maybe just to get some of your
response to some of the issues that come up so far, Ruth.
Okay, thank you, Philip. Thank you for sort of being involved with this webinar this evening as well. So I suppose the important thing with asthma is that you have to remember that September, October time is actually the worst time of the year for asthma anyway, even outside of COVID. So it's really important that people have their asthma well controlled, and more so now than ever. So it's just about getting the basics right. So if you're on medication and that you're taking it every day, and in some cases, some children will actually increase their medication coming towards school and that going back to school. That would be quite normal practice at this time of year as well. So again, so if you are concerned about that, it's important that you would actually contact your GP to organise a review of your asthma to get that done. Also, if you're using your blue inhaler more than twice a week, that's a sign that your asthma is not well controlled. So again, you need to talk to your GP about that and getting your asthma better controlled, because over-reliance on your blue inhaler is not good, and it's poor asthma management. So, and like you said, like there are a lot of concerns out there, like, a quarter of our calls into our advice line in the last couple of weeks have all been about children going back to school. And likewise with our beating breathlessness service as well, it's been the same. So it's about probably 50 to 60% on it. So it's just really important that the asthma is controlled properly, and having your asthma action plan and being aware of the 5-step rule for managing acute asthma attacks as well.
That's great, Ruth. So I just might ask, some of the questions that have been coming up are, for example, around sports. There's one parent who said they're a parent of a child with cystic fibrosis, but I think this applies to everybody with respiratory conditions, is that they're very big into sports, they really enjoy sports, but the parent is very worried, if they're involved in contact sports, that it increases their chance of picking up COVID-19. Have you got any thoughts on that?
Yes, I guess if you're obviously living in the Kildare-Laois Offaly area, I assume at this stage that all contact sports have all been ceased for the time being, and that will be the case if any other area goes into lockdown. That will be the case also. But again, it's just really important that most GA clubs now all have an app that you actually submit and parents have to do it as well, where they actually submit that their child is well before they actually go to training or to football. So that's really, or even to a match. So that's really important that that's done as requested. And again, it's a good asthma control as well, and doing all the hand hygiene issues when you arrive to the club, and maintain, maybe, I know, as far as I'm aware, a lot of dressing rooms and changing rooms aren't open, so you come to the match or to your training session ready to do your sport, and then you go home again, so you shower at home. So once all those things are in place, and you're feeling happy with that, and your asthma is well controlled, yes, you should be able to continue and you don't have severe asthma.
And Ruth or Martin, indeed, a particular question about swimming. Is there added risk in terms of your child going swimming?
Interesting question. So the first thing to say about it is that I don't think there's any specific science around swimming in relation to this, but what we can do is we can look at what we know about other things. And the real risk in swimming is almost certainly got to do with before you get into the pool and after you get out, and the contact with other people. If you're using a swimming pool, then they're usually very highly chlorinated, and that's the chlorine in swimming pool is a disinfectant. And so in the pool with chlorination, it's unlikely that the virus would survive for very long. Again, I don't know that anyone has done specific studies on it, but chlorine is a very broad active disinfectant and is active against coronaviruses. So I would say in swimming, as in so many things as Ruth has touched on there, the biggest risk in many cases is if there's social interaction on the way in and on the way out, because that's probably where the biggest risk is. So I think once you're in the pool, and if you're in the pool and you're doing lay-ins, for example, then probably the risk is very low in the pool.
Brilliant. And a similar question about public transport. A lot of concern about traveling to school and coming back from school and public transport. Do we think the kind of guidelines that are in place are adequate? And of course, will they be enforced is the issue as well?
Again, as far as I'm aware, again, this is actually on our back to school checklist about public transport. So you can access that there if you want, to our Asthma Society website, and maybe CF might be able to share it on theirs as well. So it's actually, the recommendation is that going to school, if possible at all, you either travel by bus or or sorry, not by bus, but by bicycle, or cycle to school, walk to school, or go by car. If you have to go by public transport, then just make sure that you have your mask on, and you don't use coins or money to pay for your, use a Leap card when you're getting on and off if you have to do that. Again, travel to school with somebody from your own household if that is possible. And if not, then if you are on a school bus transport system, maybe that you would sit beside the same child all the time on the way to school, so you're not, the less interaction with the more people that you have is best. So just try and limit the number of interactions that you have in an area where you can't actually social distance.
I might just add, I suppose, Ruth, the other bit on that, if you're using public transport, is it's probably a really good idea to have a small supply of hand sanitizer with you. Yeah. And do your hands, when you get, because if you're on the Lewis or anything like that and you're touching and holding stuff. So I think keep your hands, again, when we were talking about this earlier, remember I said the virus can't go through your skin. So if you're in any kind of public place, try to keep your hands away from your face, and then clean your hands with when you get off the public transport, or wash your hands with soap and water when you get home. Either one is fine, but just and do try to keep your hands away from your face as much as you can.
Yeah, I understand that actually on school bus transport there will actually be sanitizer available at the door, that when you're getting on the bus you use it, and getting off the bus you use it.
We certainly said that should be in all of the school transports. So hopefully that should be there.
A lot of questions about face masks, and primary students aren't expected to wear masks. I think secondary students are encouraged in particular circumstances. What about children with underlying conditions? Should they wear a face mask going into school?
That's always a tricky one. Like, a lot of people actually with lung conditions can wear face masks quite safely. And the research is telling us that. So it's a matter of getting used to wearing it. And there are a few steps that you can take that actually can help you get used to wearing your face mask. So when you're sitting down nice and relaxed, watching your favorite program on TV, pop on your mask for 15 or 20 minutes. And just when you're nice and relaxed, get used to wearing it. Then get up and walk around the house. And again, just be comfortable in it. And when you feel good doing that, then you can go outside and have a walk around outside. And if you can do that, you'll be able to tolerate a mask for for the length of time that you actually need to wear one on public transport.
Just to mention, I mean, obviously you're talking, about people who are at very specific risk, but but just a general piece in relation to primary school children. The recommendation that they don't need to wear a mask in primary school is related to the fact that, in the early days, there was an awful lot of talk about children as being big spreaders of this disease, but actually all the evidence that's come in the last is that children are not big spreaders. They're probably less likely to spread than adults. So the issue about primary school children in general, and now I'm talking about the generality, is around the fact that generally speaking, they don't get severe disease in general. Some do, unfortunately, and that in general they seem to be less likely to spread it, and that in general, particularly in early years of primary school, there's very little chance that children are going to tolerate wearing them. A lot of children are going to take the mask off in any case. So some of that is about pragmatic stuff, and some of it is about what we've learned about how the disease affects children and how disease spreads amongst children. It does look like as people get older, so once you get into teenage years, then the disease becomes the spread of the disease becomes more like it is amongst adults. But so that's sort of a bit of the background as to why the difference is there in relation to primary school. But obviously, we're talking to a group of people who are very special risk and very different circumstances.
Yes, so the recommendation is there that secondary school children or teenagers do wear them when they can't social distance in school, and certainly then the recommendation is there for third level students, which is a kind of the forgotten cohort, if you like. But it's important that they, the recommendation is there that third level students will wear masks when they go back to college.
Yes. Yeah.
And Martin, just a question about hand sanitizers. How long are they effective? I know we go into shops and we put on the hand sanitizer, but generally, how long should that last before we maybe put on?
The effect is, there's some residual effect from the hand sanitizer, but it will depend on the thing. But what you're relying on is with the cleaning at the time. And I've observed people using these going into shops, and the biggest problem is that people don't apply them properly. You know, what I've seen people do is they put on a bit of a squirt and they do that. And that's actually a waste of time. Now, many of you might know, if you don't know already, so the drill is that you put on enough to get your hands wet all over, then it's up and down, then you have to do the back of your hand, you have to do your finger webs. This is really important because what people often don't clean is their fingertips, and that's what does the damage a lot of the time. And then you do your thumb, and then you do your thumb, and then you do your palm of your hand. And what people, I was watching this last week because I was away for a day with my daughter, and 90-something% of people I observed who used alcohol hand sanitizer probably did no good because they used a tiny drop of it. They did that, and so it's not even the time. It's actually what you need to do is get it on all the surfaces of your hands. And as I said, this, if you think about it, if you're going to put any part of your hand in your eye, your nose, your mouth, it's going to be fingertips. So if you're not using the technique, then you haven't cleaned your hands. So it's the technique is really key. You can see it in some of the HSE websites, and you'll find it in other things, but it's how you do it is really important. And use enough. The other thing is people are sparing the hand sanitizer, and you see a tiny little drop, but it needs to be enough to wet the surface of the hands.
I think some of us are worried about being breathalyzed. We use hand sanitizer in our cars so much. It smells like gin and tonic. Absolutely, that's brilliant advice, Martin. And I'm sure it's something that we could all pass on to our children and young people as well. Because I haven't seen too many of that actually thorough hand washing. Really is really important. Just some other questions that have come up. Are there any additional precautions that people with underlying health conditions should do before going into school? I mean, vaccinations come into mind, for example. Would that be an important thing, Martin?
I think it's really important. I think anyone would agree that it's really important to be up to date with all of your vaccines because all the other diseases haven't gone away. You know, so all of the things that were there last year are going to be there this year. So all the recommended vaccines are really important, and they're going to be more important, I think, this year because the last thing you want to do is if you get hit with COVID, you want to be in the best condition you could be at the time that you get it. Because I think Ruth touched on this as well. Looking after your general health and doing everything you can to protect your respiratory health in every other respect is really important because then if you are unfortunate enough to get it, that maximizes your chance of making a good recovery. So, and this year there will be an added vaccine in the vaccination program this year for children. So that there'll be a live flu vaccine. Now, again, the suitability of that will depend on a person. You know, that's going to be generally used, but the suitability for individual people will depend on their underlying condition, obviously.
Yeah. Then they need to talk to their consultant about that. And is the flu jab available now, Martin, or will it be available in the next few weeks?
It's not available yet because the deliveries haven't come in. So my understanding is that it's expected to be delivered late this month or early next month. But the supplies haven't come in yet, is my understanding. But I understand late this month or early next month.
And will we be able to get that from pharmacies as well as
in previous years? Yeah, I think that, and indeed, I think their push is to get even more uptake of flu vaccine this year than in previous years. Again, going back to that point that I think Ruth was making is you need to look after your overall respiratory health and avoid getting other things that will knock you back, so that if you're in the best possible condition you can be in if you're unlucky enough to get this.
And just in relation to the anti-pneumonia, the pneumococcal vaccine, Martin, is that something which is important? You know, we hear varying reports about how effective it is, but is that something that should be considered?
There are a couple of different pneumococcal vaccines, and and for all of these vaccines, the protection is less than perfect, but the pneumococcal vaccine is very worthwhile. It protects you against some of the more common types of pneumococcus. One of the problems with pneumococcus is there's over 100 different varieties of it, and you can't cover them all in the vaccine. So, but the vaccine covers most of the common ones. Even the vaccines that are less than perfect offer you substantial protection, and so I I suppose I have to say that I have every vaccine that's recommended, and all my family have every vaccine that is recommended. The current, I know there's still a lot of people who are fearful about vaccines, and there's a lot of information, you know, but and nothing is perfect, but the safety protocols around the currently licensed vaccines are really very good. So my advice is, if there's a vaccine that reduces your chance of getting a lung disease by a significant degree, even though it's going to be less than perfect, by all means, you know, get it. And the chance that it's going to do you harm is extremely low, extremely low.
And the pneumococcal vaccine is you don't have to get that every year. Is it every 5 or 6 years, Martin?
Yeah, the conjugate vaccine is recommended. The old vaccine used to be given every 5 years, but there is also a newer vaccine that probably gives you longer lasting immunity.
Excellent. Okay. Just another question that's come in from one of the participants this evening is about asymptomatic children in schools. They're worried that COVID-19 doesn't show up straight away for some children. Should we be doing regular testing on children in schools?
So the asymptomatic testing asymptomatic infection it certainly occurs, and spread from asymptomatic people is a concern. But I think one of the things you have to look at is what's practical to do. So, and that goes back to a little bit about what I said about the test. So I could have a test for COVID today, and it could come back from the lab as not detected. And I could still have symptoms of COVID by Monday. So how often would you have to do the test to be useful is one of the questions. So I don't believe that it has any, I don't think it has any useful role, because I don't think you could possibly do it enough with a sufficient frequency to be useful. But obviously in a situation where you have a problem in a school, if there is an outbreak in a school, then there will probably be more general testing. But as a general rule, the difficulty is, so if I get infected today, my test will be not detected almost certainly tomorrow, on Thursday. It'll almost certainly be not detected on Friday, and Saturday might be positive on Sunday, and I might get symptoms on Tuesday. And then I could stay positive for ages. So I might be fully better and not infectious in 2 weeks' time, but the test could stay positive for, in some cases, we've seen the test stay positive for another 14 weeks after that. So testing isn't the solution. Testing has a very valuable role, but it can create problems as well as solve problems. But the solution to the asymptomatic testing is difficult. But I think it goes back to, I think, things that Ruth has talked about earlier, that thing of just of being careful about the basic things, keeping your distance, keeping your hands clean, using the masks when recommended. Those kind of things are what you can do practically to manage the risk of asymptomatic spread, but it is a real risk.
Excellent. And a question from one of our participants about what happens to a child if they are ill at school? Like what's the kind of protocol, you know, if somebody does become ill and COVID-19 is suspected?
Yeah, so the recommendation is that the child will be brought to a room, and if there isn't a room available, then they keep a distance from other children, and then that their parents are asked to come and take them home and arrange for their care as quickly as possible. So the idea is to try to, with appropriate regard for the care of the child, obviously, is to get the child separated from other children as quickly as possible, with the teacher, supervisor, or special needs assistant, who's ever keeping their distance, and then that the parent comes and arranges for them to get the healthcare as quickly as possible.
That's great. Ruth, do you want to come in there? Are there any things you'd like to respond to?
No, Martin has covered everything there about, yes, I know that all schools will have policies in place to deal with the suspected case. So it's just, again, to make, talk to your school, don't be sitting at home worrying about things. So talk to your school and talk to your GP as well. So again, like for children that have severe asthma or severe lung condition, whether it's CF or any other lung condition, it is important that with those children you talk to your GP or your consultant to see is it appropriate for them to go back to school. But every other child that doesn't fall into that group should be in a position to go back to school.
Fantastic. Listen, we're coming to the end of our webinar. It's gone so quickly. I don't know about everybody else, but I've just found it so informative, and there's so much more to learn, really. Just to say many thanks to our speakers, our sponsors, including the Community Foundation of Ireland and the Bank of Ireland, and our partners in the Irish Lung Fibrosis Association and the Asthma Society. Many thanks to Nuala Macaulay for coordinating this evening's event. She's been doing all the technology stuff in the background. Sam has been answering your questions, and the fantastic speaker contributions. So we will have links up on our website, including a lot of the information we didn't get to. But you can be rest assured that as soon as we find out more information, we'll make that available. And as I say, we see this as the beginning of a process rather than an end. And some of the issues that you've raised this evening, including the need for more specific information for children and young people with underlying conditions. And we know it was mostly respiratory patients that we were talking about this evening, but we know our colleagues in children, the Children's Liver Group also joined us this evening. And I'm sure a lot of the information was just as applicable to yourselves as well. And you're very welcome to join us. So as I say, we see this as the beginning of a process, and we'll be definitely having more webinars around the beginning of September, end of August as well, to watch the space. So thanks a million for everybody joining, and we'll talk to you soon. Thanks, and thanks to Liz for her contribution, and Sarah, I hope you get well too in terms of the sore throat. We know you did a lot of background work as well. So thanks again, everybody, and we'll talk soon. Good evening.
Thanks very much. Good night. Bye.
Thank you.